Being tired, I thought I was just being stressed. I just thought, it was life.
People with severe sleep apnea, they're existing, they're not really living. They don't have energy. By the end of the day, they're done.
Get up in the morning and not want to get out of bed. I didn't feel rested. And I kept saying to my doctor, something's not right. No one can be this tired.
Sleep is essential to maintaining good health. It allows your body to repair and restore itself. Yet many people are sleep deprived due to sleep apnea.
Sleep apnea is a sleep disorder that occurs when people's throats close off and they stop breathing during sleep. What happens is their throat can close off repeatedly throughout the night, and if every time it happens, the oxygen levels drop, their brain wakes up because their brain doesn't like to be deprived of oxygen, and then it arouses them from sleep, and that causes sleep fragmentation.
While you sleep, your body goes through multiple sleep cycles. Sleep apnea disrupts these cycles by forcing the brain to wake up multiple times each hour.
So sleep apnea is a condition where there's usually an anatomic problem. Either somebody has a big neck or narrow nasal passages or a short jaw, and they're either partially completely shutting off their airway as their body's getting down to deep sleep. So they partially wake up to start breathing again, and they may do that multiple times a night and have no awareness.
Other causes of sleep apnea include age. You're more apt to develop sleep apnea as you get older. Gender. Men are more likely to suffer from the disorder than women. A family history of the disease. And weight.
Weight is a significant risk factor for sleep apnea. In some patients that have sleep apnea, they also have this obesity hypoventilation where, because of the weight on their chest and on their abdomen, they can't move their chest wall out and their diaphragm down enough to fill their lungs completely with air, and so instead of having nice big deep breaths, they're having little shallow breaths. And it's probably a little bit of a circular relationship too. We are starting to collect evidence that when sleep is fragmented because of sleep apnea, that interferes with the hormonal and metabolism systems that affect obesity.
Without adequate sleep, your body's hormone levels fall out of balance. Many of these hormonal imbalances contribute to obesity and diabetes.
The sleep apnea may actually drive the diabetes to some degree, in part because sleep deprivation can actually make you more insulin resistant and more hungry. There have been some short-term studies suggesting that as little as 2 nights of sleep deprivation actually changes hunger hormones.
This hormonal imbalance can lead to increased feelings of hunger and can make someone want to eat more.
It's also been found that 2 weeks of sleep deprivation raises insulin and raises glucose levels. And finally, more recent literature has suggested that sleep deprivation makes it tougher to lose weight.
In addition to promoting obesity, chronic long-term sleep deprivation has an array of repercussions, including hypertension, stroke, congestive heart failure, and pulmonary hypertension.
When you take people with diabetes and treat their sleep apnea, their glucoses go down, their cholesterols go down, they lose weight, and their blood pressures go down by taking care of the underlying sleep disorder.
Snoring or sudden awakenings with a sensation of gasping or choking are common symptoms of sleep apnea. Other symptoms include morning headaches, dry mouth, and excessive daytime sleepiness.
If it's somebody that they're snoring or that they're excessively sleepy, you take that history and do a physical exam where we examine the neck size, examine the throat, and just take a look at what that airway looks like to see if it's crowded. And then we have somebody come for diagnostic polysomnography.
One of the most common treatments for snoring and sleep apnea is a customized oral appliance. These hold the lower jaw forward and keep the airway clear. To make a custom oral appliance, we'll first take impressions and bite registrations of your teeth. From these records, precise working models of your teeth are made, and the models are used to create an appliance specific to your needs. Some oral appliances are made in our office, while others are made in a dental laboratory. When the appliance is ready, we check the fit and make any necessary adjustments. For the first few nights, put it in 15 minutes before sleep to help your mouth get used to the appliance. Some initial soreness is normal, but let us know if the appliance is otherwise uncomfortable so we can adjust the fit. Identifying and treating your nighttime breathing problems can help restore your sleep and maintain your health.